The topic of insurance is a bit of a nightmare on a whole heap of different fronts. And today, as much as I was going to get my personal local medical insurance from the BPJS scheme here in Bali, which is like their Medicare, I was also contacted by one of my subscribers who lives in, I think, Melbourne. Could be wrong, sorry mate. He came over here, he had insurance, he had an incident while he was over here, hurt his neck pretty badly, ended up having to get shipped back to Australia. And here's the problem: what he didn't understand about travel insurance is the minute he got back into Australia, his travel insurance was cancelled. Now, even, and I don't think he was medevaced as such, but he had to be put on a plane because they were suspecting spinal damage and stuff like that. When he got back, none of his insurance covered the injury outside of his holiday. Now, look, I haven't heard of this before, and I'm a little bit concerned because some people have major, long-lasting, sustaining injuries, and if you don't get Medicare, or look, I've been waiting on a hospital list for Medicare for years, and it took a long time for a doctor to become available, especially if you're living in a less populated area. So I'm going to look into this a little bit more. So his claim is he bought his insurance from the same place he bought his tickets. It's at a very big brand name place that you'll see in nearly every shopping mall or shopping centre around the countryside. He walked in there thinking, I'll take their in-house insurance because it's good, and the price was good, and it was supposed to be good coverage, but the coverage lasts until you land back in the country, and it doesn't last until the injury's fixed. So even though you're paying, I think he said he paid like $300 extra for a week or 10 days worth of insurance, he didn't get his $300 worth because he only got a little bit of help when he was here, and then as soon as he got back to Australia, he was thrown on the pile and had to wait forever, and the cost of medications and ongoing complications from his injury while sustained in Bali isn't covered. So it's only covered while you're away, apparently. Look, I don't know. That's what he tells me, and I'm sure he's tried everything to keep it all above board. I've asked him to send me some details, if he can, straight from the insurance company to verify it. But I can only say one thing: if you're coming over here, just read the policy. It takes a few minutes to go through, and it's a little bit of a pain, but have a good understanding of what you are and what you're not covered for. You might be covered for theft, but you might not be covered for theft if you don't fill out a police report. Now, if you go to a police station here, quite often they don't necessarily want to have to do all the paperwork, so you might not get your phone or your watch or your whatever back, simply because the system, wherever you are in the world, doesn't allow for the insurance company's expectations or policies. So look, I don't know, guys, it's a bit of a minefield. Look, and I've got a much bigger story about insurance that I want to bring up shortly, but I think that deserves a video all of its own. So look, this is just a quick one. There is a couple of really good options and good systems over here. I've used travel insurance before, and it was a lifesaver, almost literally. So I'm not bagging the insurance industry at all. I'm just saying that you really need to know what you are and what you aren't covered for before you go, because if something goes wrong, then it could be a life-changing experience. Hey, I just hope you get over here safely, we get to have a beer together, and you get to go home safely as well. Okay, don't ask me to pronounce the words that BPJS stands for, because there it is right there. There's too many vowels and consonants, so I get the first and the last word. Badan and social. What it is, BPJS is the Indonesian version of I guess you'd call Medicare, public health insurance. And if you've lived in Bali on a kitas, on a temporary stay visa or a permanent stay visa, after 6 months you're entitled to a kitas, a BPJS membership, I guess, or policy, and that means you can actually get health insurance for $15 a month. Now, I've heard different people say different things about the level of quality of insurance, and I've seen it firsthand, and What I saw was my wife Fee had an urgent problem that needed addressing. She took it to the local pharmacy where she's at the local clinic where she's registered. They checked her out, referred her immediately same day to a specialist. The specialist did an ultrasound and realised that there was some issues, and they had to go in and investigate. 3 days later, she'd had a fairly major operation, and luckily the outcome was very, very good. I can't fault that anywhere in any country in the world. I don't think if you're paying $1,000 a month you're going to get better treatment. And certainly the doctors were fantastic. The treatment was perfect, and the outcome was wonderful. So look, insurance is a massive nightmare for people living in other countries, and you can get travellers and foreigners insurance, and for many insurance policies, or sorry, for many visas, you actually have to have insurance policy before you even get here. Once you're here, you might find it's worth having a look at the BPJS system, because for 15 bucks a month. Now, I've asked them, are you covered anywhere in Indonesia? And they said, look, if you're up in Jakarta and you have an accident or something emergency, you can go to any hospital, they get you sorted out. If I'm here in Bali where I'm registered, I need to first go to my local clinic, my local practitioner, who can then refer me through the system within themselves out to get the right specialist treatment. So look, there might be higher levels of insurance. There's 3 levels within the BPJS system, and this is for locals. If at the top level, it's about $15 a month, gives you what I've seen, which is pretty excellent care. There's a cheaper one that's about $10 a month, which is like a middle level care, and there's an entry level one for basic and emergency care, and that's like $7.50 a month per person. So honestly, there's a lot of families that aren't registered for this because they can't afford that $7.50 a month. But if they do get registered, if there is a problem and they can get onto the BPJS system, they can find that a lot of their medical costs and emergency medical costs are covered. It doesn't necessarily cover the prescriptions, it doesn't cover all your post-operative care and stuff like that, but it does get you fixed up. And often when we find people that have been injured or people that are really sick, our first question is, are they on a BPJS? Because it is a life-saving and a really handy little local insurance, as we know, don't we?
Huh?
We know about BPJS, we had to use it before. So
BPJS is very useful.
Yeah, look, it potentially saved Fee's life. So I can't fault it all. She takes Jonathan to the doctor anytime. Does it cost you anything to go to the clinic?
No, depend on what kind of the medicine. If you want a what you call
prescription.
Yeah, description is patent. We call it's like only one company make that
but
medicine.
all your appointments, your visits are all free.
No paying. Like today, I'm doing.
So you don't look. Sometimes there's a bit of a line up in the clinics. Sometimes you got to wait a bit, but it's a pretty good system. So yeah, and I've heard people say you've got to go to special hospitals and you've only got a certain level of cover, and for 15 bucks a month, I reckon it's a cheap backup policy.
Several class.
It's a very good little backup policy to make sure if you're living in Bali, you're safe. And I'll certainly be making sure my mate Al's got that, just because even though he's got his own veterans policies and all that sort of stuff, you can't go past something at 15 bucks a month that'll save your life if things get pretty serious. Well done.